My name is Dr. Aldona Spiegel, and I'm a plastic and reconstructive surgeon. So in breast reconstruction, there are two main methods of procedures that we use, usually ones that relate to autologous reconstruction, meaning using your own tissue, and implant-based reconstruction. It's important to really offer both, in my opinion, because those methods are really tailored to the patient's specific preferences, needs, and desires. The difference between immediate and delayed breast reconstruction is really mainly related to the timing of reconstruction. So in immediate reconstruction, which is really the one we usually prefer, is when we are able to do the reconstruction at the same time as the mastectomy. However, in some cases that's not possible due to perhaps cancer treatment or other logistical factors, or really sometimes even access to breast reconstruction. In those cases, we perform the breast reconstruction procedure at a later date. So one-step versus two-step breast reconstruction surgery is really related to the ability to be able to perform the entire implant-based procedure at the same time versus having to use a tissue expander to make room or expand the tissue to allow for the proper implant size placement. In those cases, we determine this by preferences of the patient. Another really important question for women is the nipple, and clearly most patients, especially in the prophylactic mastectomy patients, are able to preserve their nipple. We do have criteria for women who have a tumor that would be safe to preserve their nipple for, so even in my practice, those subset of patients that have breast cancer, a vast majority of them can get a nipple-sparing mastectomy. For the prophylactic patients, that's definitely usually our routine, that we do spare the nipple. In some cases, if the breast is large, there could be some lifting techniques that are done ahead of the preventative mastectomy to help preserve the nipple. So those are all very individualized to the patient. My 3 tips for women that are undergoing breast reconstruction surgery or considering this is: number 1, to seek a board-certified plastic surgeon. That's very important because we do have the ability to really have all the resources as far as education, which is my second tip. It's important to really educate yourself on the options and to really get the information from a reliable source. Oftentimes, number 3, patients do a lot of background work on the internet, so it's really important when you are looking at that information to again look at reliable sources so that the information you're getting is accurate and up to date. The beauty of being able to offer a lot of different choices in breast reconstruction is really to tailor it to the patient. I really enjoy getting to know my patients and really trying to understand what their goal is, because actually the success of breast reconstruction is determined by the patient, whether their expectations are met.